Epstein-Barr virus, cytomegalovirus, and HHV6. So you can get fever, swollen lymph nodes, fatigue, memory loss, brain fog, with the lymph nodes being the big one. And you'll want to get the Fix Your Fatigue blood test as well as the multiple pathogen immunoglobulin test. And like I said, I would recommend provocating it with the lymph massage or 30 minutes of exercise. And then the laboratory data, high white blood cell count during the acute phase of these infections when white blood cell count is greater than 10, or a low white blood cell count during chronic infections where the white blood cell count is less than 4. You can get high lymphocytes, which fight off viruses, and monocytes as well. In chronic infection, sometimes you'll get low neutrophils, which usually fight off bacteria. So you get this shift. There's a certain number of cells that can be made by the bone marrow for immune system function. And oftentimes, depending on what the need is of the body will shift its production to be making more lymphocytes against the viruses or more neutrophils against an acute bacterial infection. And high IgG and IgM titers on the blood serology test. And there are different ways to kind of interpret this. Oftentimes, so the IgM test or the IgM serology is the first time that you ever see a bug, first time you ever see Epstein-Barr virus, the IgM is going to react. And so that's how you know it's the first time that you've seen it. Then it sends a message back to the IgG and says, hey, I just saw this Epstein-Barr virus. I got rid of it. You got to remember because you react a lot faster. The IgM is big and bulky. The IgG is a lot faster. So that the next time it sees Epstein-Barr virus, it's going to react even quicker. So if you see an IgG, oftentimes it can indicate a memory or basically, hey, you've seen this already. But it can also indicate if it is reacting to it. It can also indicate that it is a chronic infection. So there are some more nuances to that. But if you're seeing elevated levels of IgG and IgM, you definitely want to consider treatment because the verdict is still out. There is research on it, and I've explored a lot of it, but the verdict is still out about exactly what these numbers mean. But if either one is elevated, it's definitely something you need to explore. Either one being IgMs and IgGs. And in my experience, it's very likely that someone has an Epstein-Barr virus or other chronic viral illness and infection if they have swollen lymph nodes with some of the other symptoms. Blood serology testing is confirmatory, so that helps to confirm. Very helpful. And then just another side on the IgM. The IgM also can reactivate. So even though I said it's the first time generally that you see it, sometimes it can reactivate so that you're seeing it then again for the first time. Does that make sense? Again for the first time. Okay. So make your determination, and we'll move on to the next.